carbs are not the enemy, especially whole food carbohydrates. So I tell my patients, nobody got diabetes from eating sweet potatoes and blueberries, okay? It's the ultra processed foods, it's the flours and the sugars and the vegetable oils, and especially in combination, these very hyper palatable foods. They taste amazing, right? But they're an atomic bomb inside of our bodies when it comes to metabolic function. And so for women that are insulin resistant, a low carb and ketogenic diet is a great place to start. But some women have great insulin sensitivity, but they still may want some sort of approach that decreases their risk of developing metabolic disease long term, or maybe they have a family history of Alzheimer's and they're looking for other approaches to prevent those conditions. So the ketogenic therapy, most people think of it as weight loss, but it's much more than that. Of course, most people know it started with children with epilepsy. But it looks different for women because women are complex biological creatures. That's how I like to describe us. And our bodies are basically always trying to gauge what our reproductive capacity is at any given moment, because women go through puberty and they come into these years of fertility. And the menstrual cycle is like an additional vital sign in women. If you don't have a menstrual cycle, if you don't have a regular menstrual cycle, that's telling us that there is something that has gone wrong in the body, and the body is saying this is not a good time to reproduce right now. So we have to kind of use that as a gauge of how well are we really doing things. And so when it comes to women, if you have good insulin sensitivity, reducing, carbs out of the diet might not be a good idea. It may contribute to problems with our satiety hormones like leptin. I've seen women who have driven carbs too low for too long. It can also drive the estrogen levels down, especially as the body fat gets lower. And estrogen is a great hormone for women. It's what makes us live a little bit longer than men, right? We don't equalize until we go through menopause. So estrogen is a great hormone, but we also want to be able to, what I call, use it and lose it and get rid of it and metabolize it in the liver. But there can be problems with being too low carb.